Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Rheumatoid arthritis linked to collagen glycation. Rheumatism is another word that a very wide word for rheumatoid arthritis and other thing that has to do with arthritis. But we know that rheumatoid arthritis is hereditary. That is, it's a genetic problem. And it has been scientifically proven that yes, 60% of rheumatoid arthritis is hereditary. But the 40% you may ascribe to the environment, where we talk about epigenetics. Now, there is that link to collagen glycation. The understanding of collagen glycation I had done in a recent video, that collagen is a component of many connective tissues of the body. It's a component of the bone, the tendon, the cartilage, the muscles, the skin, the blood vessels, any connective tissues. You're talking of 25% of the makeup, and that is instructive. So when the component, a major component, is in a way compromised in the sense that when people eat or overeat rather, the excess glucose, if not used, whether through exercise and what have you, will now attach to the collagen protein to form advanced glycation end products, which stiffens the collagen and creates a kind of problem, a cascade, inflammation cascade. How does that happen? When this product is now made, it's now appearing as a new substance, a new cell altogether, a new foreign body to the body. So the body in itself will now attack it. No, without understanding that collagen makes 25% of majority of these connective tissues. So in the area of the bone where arthritis really people suffer rheumatoid arthritis, then there is that attack. So that is how the autoimmune attack antibodies are produced against because the body now sees it as foreign. It's no longer what it knows. It's now assuming a different composition, and that is where the autoimmune antibodies come. These autoimmune antibodies are the one that attacks the joints to now create this rheumatoid arthritis that is experienced, and all the other autoimmune diseases that we know. But my concern in this slide is to talk more on the rheumatoid arthritis, and you will get to know more about it as we move on into the slide session. As usual, click the like button, subscribe to have more package. The outline: objective introduction, signs and symptoms, laboratory diagnosis, treatments. The objective: to expose recent discovery that linked collagen glycation to rheumatoid arthritis that results in the production of autoimmune antibodies exploited in the laboratory for early diagnosis of the condition and the treatments. The introduction: rheumatoid arthritis is a specific serious autoimmune disease where the immune system attacks joint, causing inflammation, pain, swelling, and potential deformity. It is known to be hereditary and confirmed in 60% of time that, but like I earlier said, 40% could be the environmental factors, especially now that collagen glycation has been linked. So what's collagen in itself? Collagen is the main structural protein in the extracellular matrix of the connective tissues of many animals. It is the most abundant protein in mammals, making up 25% to 35% of protein content. Amino acids are bound together to form a triple helix of elongated fibrae known as a collagen helix. It is most found in cartilage, bones, tendons, ligaments, and glycation is linked to autoimmune diseases through several mechanisms, primarily by creating novel antigens that the immune system mistakenly attacks and thereby promoting inflammation. That inflammation cascade, as usual, that will cause that attack, destruction of the joints. The signs and symptoms are very important so that it can be detected early and treatment starts equally early. Symmetric joint pain, that is both left and right, whether it's the hand, leg, or wherever there is a joint. Swelling, morning stiffness, fatigue, low-grade fever, loss of appetite with flare causing worsening symptoms. Early warnings like numbness, tingling in hands and feet that you can feel. It even stiffening at times. Difficulty with doing daily tasks involving joint movement. Rheumatoid nodules could appear, just as seen in this diagram, often near inflamed joints. Now, the laboratory diagnosis. Blood samples are usually collected to do the following tests. You could call all of them collagen profile test. Rheumatoid factor, RF test. It is positive once they above the normal range of 20 U per mil. The anti-cystic citrulline peptide, anti-CCP, that comes very early and it's specific. So once it's seen, that's very helpful in early detection and early treatment. Collagen type 2 antibody 2 is also specific for the cartilage and joints. So once it's detected, you are suspicious of the rheumatoid arthritis. Other inflammatory tests that are not specific are the ESRC reactive protein. Their values are indicated. Even protein electrophoresis, total protein normal value is 6.8 to 8.3 grams per deciliter. So when these results are above normal, you start thinking of how to start treatment. Finally, treatment. Prevention depends on the understanding of the cause. Since we know it is hereditary or familiar, one has to be very careful if there is a history of rheumatoid arthritis in the family. So there are certain diets that are very good. Even egg is regularly eating egg, boiled egg especially, is very helpful. I'm not talking of fried or grilled or what have you, but it's helpful in forming this healthy collagen and not overeat in any way as well. Then there are risk factors that must be taken into consideration, like the smoking, certain viral infections, and then one needs to also consider eating whole food with vegetable and mineral. At least the antioxidants will be very helpful in removing this aging process that makes this stiffening possible, because the antioxidant also help reduce it. The treatment per se is the prompt treatment to reduce inflammation using non-steroidal anti-inflammatory drugs, the DMARD, steroids, physiotherapy of that area, and lifestyle changes and exercises, adopting highs if it is acute, and eat where chronic inflammation occurs. More videos are available.